Humans, it's Noel with Optimal Health Associates. I want to talk about hypothyroidism, thyroid disease, thyroiditis, autoimmune disease as it relates to the thyroid for a minute. We see more thyroid disease now than I've ever seen in the last 25 years that I've been in practice. I think a lot of it has to do with iodine deficiency. The iodine deficiency rates, which most people don't think about, are running about 70% now. And once the iodine deficiency rates have come up, the thyroiditis rates have come up, and once the thyroid gets inflamed, the function diminishes. And so I think that's a huge part of why we're seeing so much thyroid disease. Once you have irritation in the thyroid and you get diminished function or intermittent diminished function, supplementation becomes important. First with iodine, second with things to try to tone down the irritation. But then what is the role for thyroid hormone, and how do you mix the thyroid hormone supplementation? Because there's ultimately T4, which is levothyroxine, or T3, liothyronine. And the classic approach over the last 40 to 50 years is to use levothyroxine. More recently, I think in the lay literature, there's to use a lot of liothyronine or a combination of product more commonly thought of as Armour, or something that has T3 and T4, which is actually retro, and that's to use a combo product, which was really what was used from 1900 through about 1960. What is important with all of this is just to remember there is no one size fits all for the patients. Ultimately, T3 products can be very helpful for weight loss versus T4 products. T3 products, though, do have can be more agitating, cause more palpitations, cause more icky side effects than T4 products. If you look at studies, T3 products seem to be slightly more positive by patient perception. They clearly associate with better weight loss than T4 products, which don't really seem to do anything for weight loss. So we always just have to individualize for patients with these subjects and work through it very, very diligently. But it's not as easy as a subject as patients would like it to be, nor for the providers. And I just want to emphasize that. Making the whole thing extremely convoluted too is endocrinologists have been trained very, very specifically to use T4 products predominantly and not T3, T4 combination products. And if they're going to use a T3 product predominantly, they're going to use something called Cytomel separately, which is just a T3 product. And so it gets very confusing to most patients on different approaches. So everyone has to just always remember to take a deep breath when you have hypothyroidism and know we're going to do our best to work with you to try to get you better. The endocrinologists are going to do their best to try to get you better. And we just all have to try to stay on the same page. My final thing to remind everyone is that a lot of people with hypothyroidism get on high doses of T3 products to feel better. And they then get super suppressed TSH levels, or they have way too much thyroid. And they then believe that that is a successful plan because if they drop their thyroid levels to more normal levels, they feel bad and they think, oh, I don't have enough thyroid. That is an incorrect concept. All that they're doing with the higher levels of thyroid supplementation is overtreating themselves. That overtreatment may make them feel better, but it's because they're missing some other piece that needs to be corrected. And ultimately, being overtreated with too much thyroid is not correct. And given the opportunity to correct whatever is missing normal treatment levels of thyroid will be adequate. But we have to figure out what is being missed, which makes the overtreatment of thyroid appear to be necessary. So just remember, thyroid stuff's more complicated than most people think, and it takes more effort than most of us have ever thought to get patients to feel better. And that's just the summary on that. So take care.